Happy Friday, or should I say TGI Friday. This is John McEntyre Show Live. I'm John McEntyre, and I'm quite sure you recognize the person sitting to my right here. And if you don't know, this is Andrea McEntyre, one of my resident experts here, financial experts that appears on the show. She hasn't been on for a while, but um, we're covering a very important topic today, and so that's why she's on. She'll probably be on much more often, at least weekly, as we talk about these particular topics. So I would do that normal awkward chatty stuff. So Andrea, how are you today? Like we're not married. I watch some of the shows with the husband and wives, and they're like, "So how are you today?" You should know. You've seen me for the last 5 hours. But
Well, I'm doing well, doing really well. Excited. Thanks for having me on. And I've really been enjoying just the approach, the wallet wins, and celebrating with others and sharing some of the stories. So uh, I encourage everybody, keep interacting, keep sharing, keep asking the questions because it not only helps you, it helps other people too.
right, right. So today we're going to get into it. But we have to cover our wallet wins. Going to cover a few wallet wins here, and then we'll get into the subject, topic, or question, which is today is about Medicare Advantage. We'll cover that. We'll cover the wallet wins, and then we'll get into that. So wallet win number one, we started our kids on a retirement account, and yeah, that's a that's one
Oh.
of those nice long time wallet wins there.
Yes, I know some people may be asking the question, well, why would you start a kid on a retirement account right now? Well, you want to give them as much, as you've said, runway or time as possible
That's right.
to be saving.
Right? Because I heard a financial expert. He was saying uh, invest early and invest often, and that's one of the most consistent and safest ways to build wealth because you get in early and then you stay in and you let time and the eighth wonder of the world, which is um,
Compound interest.
compound interest kick in, and so and plus it just builds a habit. You catch a kid early teens or even earlier, start teaching them about this, then you won't have to argue about that, and you decrease the chances of them boomeranging later on in life, which is the term for moving back home. So you do things like that.
It's
So
not an old 90s flick.
yeah, it's not an old '90s flick. Exactly. I forgot about that. Eddie Murphy. Yeah, Boomerang. Um, so that's wallet win number one. Wallet win number two, which is a good one. We received back pay from an oil company that found oil on our land years ago, but never sent a check. So I would have liked to have seen what size check it was. I wish they would have shared that. That would have been nice because finding oil on land, on your land, being in real estate, seeing that a few times, especially in North Carolina, it's not exactly oil, but it's other minerals, precious
Mhm.
precious stones and stuff like that. Especially as you get up into the mountains, or here we're
Yes.
into one of the metals that they found. Actually, companies moving here and all of that. I don't want to go into too much detail because it's still like a sensitive topic to a lot of the
Yeah.
local residents here. But yeah, especially up there in the mountains, you do have some gold. You have some other precious metals and stones that are constantly being found, and a lot of times with real estate transactions up there, they it's always a clause in there. Are you releasing mineral rights, or do you want to share mineral rights? If you hit, if you do strike something, you find something, so those contracts can get very sticky.
Well, it brings up a very good point. Going back to it's school time back in session, reading's fundamental.
Mhm,
So want to make sure that you're reading the contracts, reading the details,
mhm.
and that you have some support
Right,
because it can get, like you said, sticky.
right, that's right. So that is a good wallet win. I bet that's a very lucrative wallet win. That's a
Hmm.
life changing. That's a lottery style, probably a lottery style wallet win there. Wallet win number three. completed the last of school shopping, caught some supplies on sale. Now, that was smart because most people don't think about it. School supplies have already gone on sale.
Yeah.
uh, because pretty much school is up and running. It's only a
Hmm.
few districts that haven't went back yet, but around here, everyone's in school now,
Hmm.
and so now the sale signs have popped up.
Yeah, that was a really good proactive choice. I don't want to burst their bubble. Back to school shopping is never over.
No,
There's going to be the year round shopping, but the major expenses, congratulations for getting those
well,
out of
you
the
have
way.
you have you have preschool shopping, and I mean preparing to go back to school.
Hmm.
That's the back to school shopping. You have the during school shopping because things change. These kids hit serious growth spurts. Um, One in particular that I don't want to mention her name. She lives in our household. She jumped an entire closet full of clothes, new clothes, from October to December. She went from what 10 percentile to almost 50 percentile,
Yes.
and and so that was like that hurt. But the good part, the tags were still on most of the clothes, so you consigned it with someone and actually made a good profit and traded. He was
Hmm.
actually able to trade. But yeah, that's the during, and then you have the post school shopping. So
What's that?
now they're out of school. They have to look good for the summer. so so basically what I'm saying is it does to your
It
point,
doesn't
it
end.
doesn't stop.
It
Yeah, it
doesn't end.
doesn't stop. Yeah, it's like hip hop. It just don't stop like that one did. Um. So yeah. So that was three good wallet wins that were shared with us today. And make sure, like Andrea said earlier, to share your wallet wins. Now, let's get into this today's topic. Today's topic is about Medicare Advantage plans. And the reason why we're covering the topic is two. Number one, it's been, I mean, in all seriousness, over probably close to 60% of our people that interact with us are either they're right near retirement age or they're in retirement age.
Or they're working with a family member who's
Yes,
in retirement.
yes, there's something. Yes, exactly. Probably, so I even have to up it up even more. Probably 70. Now we're talking like 70, 75% of probably what we talk about with clients, potential clients, and just people that are watching and interacting with us. It has something to do with retirement, um, and a lot of times, specifically, and even over half of that is healthcare, because healthcare is the largest expense once you've aged.
Yes.
Once you've gone into a retirement, just say 60 plus, 60 years plus, um, healthcare becomes the most important topic that or concern. Let's just say concern. It is the number one concern because it has caused a lot of issues. People that uh, maybe didn't plan right or something. They're making choices on: do I buy my medication? Do I go to the doctor? Or do I eat?
That's a tough decision to be, making. And it's not a decision that anyone plans to make. It just happens.
Right, and that's that's the issue: the lack of planning. And so that's what we want to do here is to get people. Number one, my number one thing I'm an advocate of financial planning. Um, just personal finance, financial literacy, but especially financial planning. And we do have a place in our hearts for the retiring, the aging community, because we've gone through in the last few years, last decade, and we're in one now to where we're dealing very intimately with these types of situations, not with others, but personally, on a
Yeah.
personal basis.
Hmm.
Number one, lost my mom to dementia. That was pre-COVID, and we had to go through a crash course. And at that time, I was beginning to really go into Medicare, understand Medicare, because it wasn't something that I understood. I really didn't talk about it much, a little bit, but then I went through these situations, and it seemed like more and more people were asking that question, and it was mainly the caregivers, the ones that was actually taking care of the kids and those people, family members of someone that was getting aging, going into retirement. And so I was like, okay, well, we have to really address this situation, to get in front of it. And so I did a couple of shows a few years ago, a couple of episodes on Medicare. But here lately, I was like, okay, this is something we're really going to have to put time, because we want to respond to the market, what the market wants us to do. And so
Mhm.
that's what we're doing. We're responding because people have more and more questions. I mean, every day there's a concern. Um, you go online, you go, probably every other. I follow a lot of financial um, experts online, especially Facebook. Probably every third post is something about Medicare, or senior care, boomer care. There's something in that category that's like popping up in retirement planning.
Absolutely. And I'm glad that more and more people, unfortunately, some people are having these discussions or thinking about these things because they're facing the situation. They're
Hmm.
either about to, they're facing whether or not they should make the decision on when they should, you know, start taking their Social Security or
Hmm.
retirement
Hmm.
benefits.
That's right.
And I will say, being in the industry for over 20 years, one of
Hmm.
the things that everyone has not always paid more attention to is been when we focus on retirement, we don't always talk about, are you aiming for the right things?
Hmm.
Because there's
Hmm.
different
Hmm.
seasons that you're going to be going through, and it's always about the fun stuff. What do you want to do when you retire?
Right.
So that money, that target bucket of money that you're setting aside is generally talking about growing that money for travel or things you want to do with
Yes,
your
the fun
kids.
stuff. Yeah.
And not a lot of people focus on the day-to-day life matters that can really eat up your retirement income, because more people are afraid, am I going to outlive my money? And that
Yeah.
fear is
That's exactly
because
right.
expenses that they didn't factor in, which was healthcare, is what's eating up most of that money.
That's right. That's right. So we want to make sure and cover it. Why I'm starting today. I had someone yesterday was like, "So when are you going to start talking about this?" And the suggestion was made. Why don't you dedicate a Friday, each Friday? You talk about a book, or something like that on Friday. How about this? And as I thought about it, I looked at the looked at the calendar,
Mhm.
and we follow a calendar of what things you should be doing financially on the calendar. In about 8 weeks, in about 2 months, if you haven't already, if you are going into aging into Social Security 65, Medicare, you're close to it or you're already in it. I'm quite sure you watched television and you've gotten your feel of Medicare commercials. Your mailbox is probably leaning with so many Medicare inquiry letters and mailings sent to you, packed up. I know my daddy was talking about that. He was like, every day I get something. I mean, I've already told him. I said, don't worry about it. It's going to keep happening. So you're at the age. It's just what's going to happen. Or you're afraid to answer your phone now because you're afraid that it's someone trying to sell you Medicare insurance or enroll you into a Medicare plan. So that's why I'm starting today, is to get ahead of it and to share the education part about Medicare Advantage specifically, because in October 15th is the day where Medicare Advantage plan enrollment starts. That's called AEP. That's for people that have already enrolled into Medicare. That's when they can change their plan.
They call it, the AEP stands for
Annual
annual
enrollment.
enrollment period. And for those who are not of age, think about, maybe it's your annual benefits time for you to choose benefits if you're working for an
Mm-hmm. Exactly.
employer, or if
Mm-hmm.
you have a business and you're providing health care
Mm-hmm.
to someone, that it's your enrollment period. Every year you have to make choices for the upcoming January,
Yep.
new year.
Yeah, exactly. Exactly. So that's why we want to get the head to start educating, because we talked to some of the lowest income people to some of the highest wealthiest people. I mean, $10+ million net worths.
Mm-hmm.
They built businesses. They're smart. These are not, well, there's no such thing in my book as a dumb person. These are highly intelligent folks. They've managed their money well. They've done everything right. They've even exceeded expectations and made more money than they could ever use in their lifetime. And they still say, I just don't understand Medicare. They was like, I can build a business all day long. I understand my industry or whatever, this, that, and the other. I can manage my money. I can even pick an investment. This Medicare thing is confusing. So that's why we're covering Medicare, because and unless you're going to self-insure your entire existence, you're not even going to use any type of health care, which I would, because I paid, you probably had paid for it. If you paid Social Security taxes, you paid for most of it. You're going to touch Medicare. Some people, they may go through life and they may not have an IRA. They may not have, they may not even buy a house or something. But if you live long enough, you're going to touch Medicare.
Yes, yes. And if you live long enough, you will need some type of healthcare assistance. And so,
No, if you're living, you need health care
yes.
assistance.
So, Medicare, to simplify it for everyone, it is dealing with your health care as you're getting older.
Yes.
It's
In
more
retirement age.
in retirement age.
Once you retire. So why we're talking about Medicare Advantage today is because here's the statistic. There's 32.8 million beneficiaries. Those are people that are on Medicare. They're called beneficiaries. 32.8 million of them are on Medicare Advantage plans. That's 54%.
Wow.
So, us, other experts talk about it. Don't buy or invest in something you don't understand. What I've come to understand out of this 32.8 million, this 54%, maybe 1% of them really understand what they've gotten into.
Yes.
Because what we hear is, we hear the complaints because they chose the wrong plan. They chose a plan of their friends or something like that. Their friends using it, and so they thought they would enroll in it, and they just did it off the fly. Someone called them one day and talked them into enrolling in a particular plan, um, and now they're stuck with it for at least a year.
Mm-hmm.
So that's why we want to cover some of the Medicare Advantage plans. We've been talking, and let's really get into it. For years, when it came to Medicare, Medigap was the only other choice you had for Medicare insurance. You had Medicare insurance, but then you had Medigap. Medigap has been around a long time.
Well, I want to pause for a moment and just explain the basics, which is Medicare. There's original Medicare,
Mm-hmm.
which has Medicare A and B,
Mm-hmm.
and that within that, that's been the traditional. And then if you did not want to use that or wanted to have more options, that's where Medigap came in.
Right, that's exactly right. And you had to buy a prescription drug plan and things like that. So what happened is that the thing with Medicare, Medigap, let's say Medigap,
Yes.
Medigap comes with a premium, and it can get quite pricey. So that put a lot of people out of the running for a Medigap policy. They just couldn't afford it, and so the government responded with a Medicare Advantage plan, which is private insurance. It's a private insurance company. You've heard of the Humanas, the Aetnas, the WellCares. Um, they came along and said, okay, well, we will provide the service. CMS, which is the governing body of Medicare,
Mm-hmm.
Center for Medicare Medicaid Services, said, okay, for us to okay this and to agree that you can provide these services, you have to baseline provide every service that we provide. And so the private companies said, okay, well, we can do that, and then we'll add more to it. We'll add some perks, and we'll talk about some of the perks here in a few minutes. So that's when it came along and made it more, and they actually made it more affordable to the beneficiaries that couldn't afford what you call Medigap, or thought that they couldn't afford it. And so that's where Medicare Advantage came along. Um, by enrolling in a Medicare Advantage plan, basically what that's saying is you've directed the Medicare to allow this company to take care of all of the services, Medicare, and then some.
So you basically
Hmm.
transfer the risk and those activities to that company.
Right, to provide that company is now providing the medical care.
Yes, the private insurance
Yes, you're
companies.
no longer off Medicare because that's the only way you can get the plan. You have to be on Medicare. You have to have both Medicare A and B to actually qualify for the Medicare Advantage plan.
And you have to continue making your premium payments to
Hmm.
be.
Hmm. And so this that particular company, that Humana, that Aetna, that WellCare, will provide all of those services for you. They'll deliver all of those services, and most of those plans will have a drug coverage included.
Yes, and if they don't have a plan included, then you can purchase an additional one, which is often called uh, a prescription drug plan or a Part D.
Right. That's right. That's right. And so to enroll in it, you have to have the Part A, the Part B. You have to live in the plan service area, because that's one another thing that's so confusing about these plans is that they are zip code driven, regional driven. Some are regional, some are zip code. It depends, where they are. You have some of those large states with a lot of counties or parishes. You're going to see a lot of plans. There's hundreds of plans out there. I mean,
Absolutely.
hundreds, seriously, hundreds of plans. They address certain some, and we won't get too deep into that. They Some plans may address only people that's on Medicaid and have diabetes or heart issues or something like that. And so you can tell how deep. That's why we're going to take our time with this. And um, I'm responding to the market who's saying this is very confusing. I understand. We could talk about Medicare for years and barely scratch the surface. So that's the part you have to be in the plan service area. And like Andre said, continue to pay that Part B um, premium. You don't pay A because that's what Social Security took care of. If you work 40 quarters or 10 years, pay Social Security, you're entitled to the Part A for free, zero.
Absolutely. Absolutely. And as that as the Medicare Advantage plan rolled out to give more options and help it be more affordable if the original Medicare um, didn't fulfill your needs,
Mm-hmm.
then we decided to do you more of a service, and the industry responded and worked with CMS to come up with additional supplemental plans. And so we're focusing just on Medicare Advantage,
Mm-hmm.
but that is something else that people has probably heard about, and we'll cover that. I'd
Yes,
love to come
yes,
back and talk
yes.
about that in the
Supplements.
future.
That is the Medigap. That's the other term for
Yes.
Medigap is supplement plan.
Hmm.
So some of the other features of a Medicare Advantage plan, they have what is called a maximum out of pocket. In the industry, they call it MOOP, but it's maximum out of pocket, which is saying, on Medicare, see, Medicare doesn't cover everything. It
No.
doesn't cover. It doesn't pay for everything. That's why these insurances, the Medigap and supplemental and Medicare Advantage are so important, is because they come in and fill those areas. Well, Medicare Advantage, it has a maximum out of pocket, which is determined by the company. Each company has their own limit, averaging out around about $8,000. Once you've hit that, you don't pay anything else. The company takes over 100% and take. So you go to the doctor and you have a copay. Once you hit the maximum out of pocket limit, you don't pay copays anymore. You don't pay. You're done with deductibles. You're done with all of that. And that's on the actual in the plan. On the drug side, this is totally separate. You do have limits on that side also, but that's specifically for the drug plan. This is for the Advantage plan. You have a maximum out of pocket, because sometimes if you're going to the doctor quite often and visiting specialists and things like that, those costs can stack up quickly. I mean,
Absolutely.
they can stack up real quick on you. And so once you hit that maximum out of pocket, you're done for the year. And these plans run calendar year, January to January 1st, December 31st.
And another thing to mention with that is with them running calendar, every single year you have to re-enroll. You will get an update that lets you know, hey, here's what may have changed. So if there are things that your plan provided in 2024,
Mm-hmm.
you likely will be getting, well, you will be getting an update in September to say, here's what's changed with your plan. And then when
Right.
you get
Mm-hmm.
that, you need to, don't just toss it into junk mail or into a pile.
Yep.
Read through it, and even call the company, call your agent. You can even call us. And you want to look at, what does my 2024 plan provide? And then what does the 2025 year, what's changed? And will that benefit me, or is it a disadvantage and I need to maybe look at other options for the next year?
That's right. That's exactly right. So that's why coming up October 16th, 15th, AEP annual enrollment period. That's what is they're giving you. You're basically setting up, like Audrey said earlier. You're setting up for the next year. You're
Yes.
setting up. So when you get calls this year, you're setting up for 2025. That's what's going on there. And so with these particular policies, what makes them so popular is that they do have some of the perks that Medicare doesn't, provide. One, it makes it very attractive, and normally what you see on television and then it's pushed really hard is the zero premium.
Yes, I really want to caution people. I know that zero premium, paying nothing, it sounds very attractive, but pause and look at all options, because when you don't pay a premium, there is a possibility that there's some another benefit or service that you could be giving up.
Hmm.
So, free is not always uh, free.
Right, exactly, especially in America, and we know that.
Yes.
Other perks, dental, that makes them attractive because they some plans they help with, those annual visits, teeth cleanings, things like that may help with dentures,
Hmm.
um, those types of things. X-rays with dental, vision helps. Helps. Yeah,
Glasses,
eyeglasses, your eye
contacts.
exams.
Hmm.
Uh, Medicare handles what is it? Cataract surgery.
Yes.
Handles cataract surgery, and if you need those particular glasses from cataract surgery, they will pay for those. But outside of that, that's all that Medicare is going to take care of. So that's when the plan kicks in, and it may, you could go to a place and get an annual eye exam, and it may help with the eyeglasses and things like that. I've seen some people, some people with some smart that made some smart decisions that really um, didn't take it. They just took advantage of what was being provided and actually ended up with a couple of pair of eyeglasses, you know,
Hmm.
by doing it the right way. Hearing helps with hearing. It may help with hearing aids, those certain supplies that you need, your hearing exams, things like that may help. And probably the number one is the gym membership.
Well, this is the part that all of these perks and benefits, they seem so common
Hmm.
before you get into, your senior, more mature years. They seem so common and so basic that a lot of people just forget about them. They're
That's
like,
right.
oh,
Yep.
I forgot. I need to make sure that my dentist will still be in my plan, or does my plan even provide that? And so the
Mhm.
dentist, the eye doctor, those are common things. And you hope that your health level stays constant, but there's no guarantee it's going to stay constant. So the part that I'm like smiling and laughing about is your health. You're like, oh, well, I've got more time, I'm gonna work out now.
That's true. Yeah. Or at least hang out at the gym at the local Y or something like that.
Yes,
That's where I
there.
get my funny stories at the gym. Is from we call them the silver sneakers because it's
Yes.
on some plans that's what it's called. The membership is called silver sneakers.
Yes, and they have their coffee chats and coffee corners. And it's one of those things that is beneficial. Not, some are still very physically active, and that's great. You continue to move and stay mobile and improve your longevity. But the other part of that is the social aspect.
Right. So that's what the some of the perks are. That's the big one that most people enjoy the most, is making that gym membership, because some places gym memberships can be expensive, and this will cover it, and
Yes.
that's what makes it so attractive. So going back, we touched on it, and that's why I say that we gave a lot of information in this short amount of time.
Yeah.
And so that's why I say we're going to just share probably every Friday some more about Medicare. You give your questions. Before we get into the question of the day, before we go, we have to remember that these are not Medicare Advantage plans, are not Medigap or supplemental plans. Like
Yes.
Medigap and supplemental are interchangeable. It's talking about the same thing. They're totally different. Uh, Medicare Advantage works instead of Medicare. Medigap supplement plans work after Medicare. So with the Medicare Advantage plan, you receive a card. All your information is on this one card. You no longer have to carry a red, white, and blue card. You no longer have a separate drug plan card. There are some Medicare Advantage plans that don't have drug plans in them, and those are few and far between. But most of the time, it has all of it in it. You have one card that you carry. Uh, Medigap supplemental happens afterwards. What Medicare didn't cover, supplemental will kick in and take care of the rest of it. That's how both of them work. That's the big distinguishing factor. Medicare Advantage, they're not permanent. They run Medicare supplement can be permanent. Once you enroll in it, you're pretty much in it, unless you decide to make a change.
Right.
Medicare Advantage runs calendar year. If you wanted to stay in the same plan, you would have to let them know, or they would say, okay, if we don't hear from you, we'll just take that as being you're going to stay in this plan. But you will receive some type of communication. They have to communicate with you, um, just so to get your okay that you're going to stay in this plan. And that's what AEP is all about. There are some other instances where you can change plans throughout the year. That's special election period. We'll cover that. But for today, we have AEP on the horizon. And so we just wanted to start the conversation about that, just to get it into your mind. So now you can make a more informed decision. And if you needed help with that, you can give Andrea a call, contact us here. We'll direct you in the right direction. We've enrolled plenty of people into Medicare plans, help them choose the right one, and sit down and actually help them with a budget before they actually made a choice, because sometimes they can actually choose something. They think that they're stuck in this particular category. After a little bit of budgeting and move some money around, they actually qualify for even better coverage.
Absolutely.
And so that's what we do here. If you want to help assist them with that, we could help you with that. So if anything else if you wanted to add to it, then we'll do the question of the day.
The main thing I want to make sure people understand is it's a lot of information. You don't have to do it alone and be overwhelmed, but take your time and make sure that you're asking the right questions. What type of options do I have? Uh, Look at the cost, but don't let cost be the only driving factor. Make sure your the benefits that you need, whether it's, they call them perks, but if you need some of those benefits, make sure that you have some of those options available, and then also make sure that your drugs, that you have a plan in place to cover your prescriptions,
Mhm.
and don't just count on that you're healthy today, that you'll always be healthy.
Right, that's right. All right, so let's get into this question of the day, which is, how do you plan to pay for your health care when you retire? Building off what we've just talked about here, we've talked about retirement. So, how do you plan to pay for your health care in retirement? So, that being said, Andre, thank you for being with me. We'll see you next week. We'll be back Friday. You'll be back Friday with us. We'll cover more. And in the meantime, if you have any questions about Medicare, whatever, or you want to save them to next week, send them to us. Don't forget to share your wallet wins, uh, the questions, any other comments for other shows, other days, non-Medicare days. We will answer them for you. So, I hope you enjoyed it. If you did, like it, subscribe, share it with others, share the love. And until Monday. We'll be back Monday. Don't look for me Saturdays, off day. That's pizza day. We'll see you Monday, same time, same channels. We'll talk.